Assalamu alaikum, I'm Dr. Tahira and you're watching program Health is Wealth on PTV World. Our children are our future, and how do we conserve our future? By taking care of our children. Our real wealth is the health of our children. That is why today we will be discussing in detail children diseases, children development, and how we need to take care of our child. Assalamu alaikum, welcome to another episode of Health is Wealth, and today we are discussing who is more important to us than ourselves. Who is it that we love more than ourselves? Obviously, it is our children, and we are extremely careful with things affecting our children. That's why we thought, why not discuss in detail today with our very good pediatrician, who is Colonel Sohail Aslam, who is a pediatrician serving in Islamabad and the Twin Cities and serving the nation for a very long time in terms of dealing with all children diseases. Thank you so much for joining us today, Dr. Sohail. How is everything? So first things first, like children are going to school nowadays, and it is actually the exam season is also coming over, and a lot of children tend to fall sick because of the exams or not. So what are the reasons why are children so susceptible to the latest allergies in Islamabad? Let's talk about allergies first, and then we can move on to the different things.
Thank you very much for inviting. It's very hot topic in Islamabad Twin Cities nowadays. As we know that in Islamabad, a lot of vegetations and pollen season is very common. This asthma and breathing diseases are very common in children nowadays. We are coming across so many kids coming with the breathing difficulty, night coughs and running nose and skin allergies and skin rashes.
Right.
So it's very common nowadays in Twin Cities, and a major illness, major reason for the school absence, and all the night children keep on coughing because of this asthma and these pollens. So in the morning they are not that well to attend the schools, and that's why the school absences and poor performances.
So what is the reason exactly? What are they allergic to? Is it only pollen or is it dust? And why have children all of a sudden become so, allergy sensitive now? Before, in our times, children did not have as many allergies, but now we see a lot of children having so many allergies to so many other things that are in the environment, and even ingestibles and even food. What could be the reason, and how do we prevent this?
Actually, this allergies and asthma, it was underdiagnosed condition previously. It was there, but it was underdiagnosed, and now the other main important thing which we should consider is environmental pollution. It is very it increase in the whole world and in our part of the world also. So these two things, as a physician admit that this was underdiagnosed condition. So the bronchial asthma, in certain seasons of the year, it is more prevalent because of the environmental increased pollution, pollens in the area. But other causes like powdering, use of perfume, dust allergy, mites, and dust, and so many construction going on in Islamabad rooms.
Yes.
Almost
more deforestation and
deforestation and
yes.
and the construction of the roads and
yes.
all that.
True. So how do we prevent our children from being exposed to these allergens, or how do we increase their immunity towards allergy? Is there any way to do that?
Actually, there is oversensitization of the kids, avoiding powders, perfumes, and making houses dust free, and avoiding these mites and
avoiding pets,
keeping pets. Pets keeping is more common now.
Yeah.
Cats in the house is causing this problem, and kids are very much
susceptible to go and play with them.
To these pets, so that's why. And then stuffed toys.
Okay, so their hair also keep coming,
stuffed toys,
and even those, I think the very woolly blankets also, all of them.
They have increased, and playing outside in the lawns where there are pollens. So if the triggers which is causing this problem should be identified by the parents.
Okay. What about nutrition? What should they be giving for two children so that they don't develop these allergies? Does vitamin D or vitamin C or such things play a role in immunity, or they don't? Should parents be supplementing the diet of a child with these things so that they're less allergic?
Role of diet in the allergy is much overemphasized. I think there are very few things that seafood and peanuts which can cause allergies, but generally there is no specific food which can cause this breathing difficulty and all that. So all is a balanced diet.
Okay.
Concept of a balanced diet is very important. We should not be specified to any one part of the food. The proteins and carbs and dairy products and seasonal fruits are very important. They should be given in a proper combination to the children.
Okay. So if somebody has asthma, how does a parent identify that my child actually has asthma, so that they can take them to a pediatrician, get them treated and follow a proper line of treatment? For example, I've seen asthmatic students and children, they're using all these spacers and nebulizers or specific medications. So what is the difference between, how do you differentiate between an atopic child, someone who has a tendency to develop or has full-blown asthma, and somebody who just has a seasonal allergy or flu?
Asthma is a wide spectrum disease. It can be intermittent and it can be persistent. Intermittent, we say that in some part of the year, in some seasons, child become breathless and night cough. The early sign which a parent could detect is night cough. Child is restless at night, early morning he starts coughing, and there is a noisy breathing at night.
So that wheezing
so
is
there. In a medical term it's a wheeze. So if the child is having a noisy breathing or coughing at night, most of the night, then parent should be alert. And if it is more frequent, in respiratory tract infections, it will be associated with fever also. Fever and running nose and breathing difficulty. This is more specific of the infections. But this asthma, it is because more without fever, and symptoms are more exaggerated at night and at the sleeping time. So if it is not relieving with antibiotics, and the child has to go again and again to the physician, so parents should be worried, and the alternate diagnosis should be considered.
So what's the role of antihistamines or these other nebulizations, bronchodilators or steroids in the treatment of asthma?
There is an international body called GINA, Global Initiative in Asthma and Breathing Diseases. That it has a very elaborated guideline for the treatment of the asthma. Anti-allergics have no specific role for that.
So they should not be giving so many antihistamines, because a lot of people tend to overdose the antihistamine because it makes them sedated and it puts them to sleep, and they're like, oh, the child is very peaceful now, without realizing that it's not actually curing the problem. Right?
So actually antihistamine is not that much effective in this condition, and giving I have seen patient even newborn and infants and very young children given these antihistamine which are not actually indicated. So proper diagnosis, that we have to diagnose that the child is asthmatic, and then for that we have to make a plan. If the child is have intermittent asthma, then we have to treat that particular episode in that part of the year. But if the child is having a persistent asthma, that it's going on for years, so then we have to make a plan. Then we further divide it into mild, moderate and severe asthma. If the symptoms are very regular, daily, and the child's routine activity is being hampered, then at that time we have to intervene with these inhalers and spacer devices and regular medicine for that. And montelukast is one of the drug which has, these are the which actually is one of the indication for the moderate persistent. Generally we treat with the long-term inhaler with the most potent, as we know, anti-inflammatory steroids. So it is very much fear in the parents, in the minds of the parents, that if we give this steroids, it's going to harm. But GINA has categorically advised us that in these children, the preventive medicine is actually steroids. So we have to give long-term low dose, moderate dose, and high dose depending upon the severity of the asthma. We have to give these inhalers in inhaled form.
So we have tuberculosis is also very common in our country, and as you spoke of children having night cough and night sweats and fever and everything. So how rampant is tuberculosis in our country, and can you please tell everybody watching that we have a complete treatment for tuberculosis now? It is not something untreatable, and the moment they start seeing or noticing these symptoms, they should get to a pediatrician and get their children treated before it gets worse.
Unfortunately, tuberculosis is still prevalent in our part of the world, and as many other communicable diseases, despite the effective vaccines, we are not able to eradicate tuberculosis. The most important thing which we have to think of tuberculosis is a cough persisting for more than 2 months. If the cough is for more than 2 months, always consider tuberculosis. And the other symptoms associated with tuberculosis are not gaining weight, rather losing weight, night sweats, fever, irritability, and the child will not be thriving. Fever and night sweats and not thriving are more associated with tuberculosis than the asthma.
What about pneumonia? We see a lot of children losing their lives to pneumonia. What exactly is pneumonia? How does it happen? How can we prevent it? And how quickly should a parent act if they are told that the child has pneumonia?
Pneumonia is still in our part of the world #1 killer of the kids under 5 years of age. And in our part of the world, diarrhea and pneumonia, we come across these two diseases of the kids, and #1 is pneumonia. To diagnose pneumonia, actually pneumonia is WHO has now made so easy for parents and healthcare givers, even ambulance drivers, to identify pneumonia. Pneumonia has to be identified. Pneumonia identification is so simple now that you don't even need a stethoscope. You have to just count the respiratory rate and the movement of the ribs. If the chest is moving so rapidly and there is indrawing, then it's pneumonia. And respiratory rate for the different ages is different. And you have to see in a calm child who is not crying, and you count a respiratory rate more than 60 in an infant, then it's a pneumonia. So whenever it's fast breathing, always be attentive to the child. And the second thing is dipping of the chest. If it is dipping too much, and there are so many local explanation of these findings. They say chhati ka chalna, and there is. So if the mother notices that the child's chest is moving rapidly, always be attentive that it can be pneumonia. And the other thing is fever associated with that, and it's very simple to treat now. It's a very treatable condition. We just diagnose and give antibiotics, proper antibiotics.
And hospitalization is must with proper intubation and all of that?
Most important thing is requirement of oxygen. We have to give oxygen and then proper antibiotics for a specific period of duration, and it is very much treatable with no sequelae.
When we take vaccinations, we take these DPT, that diphtheria, pertussis, whooping cough. Is that also still there? How important is it to take vaccination for DPT? And if somebody develops any of these diphtheria, pertussis or whooping cough, what is the line of treatment for that?
Whooping cough, it was, we used to see very seldom a child with whooping cough, but again it's surge again. Even in developed countries, we are seeing in states, United States, they are facing this whooping cough again. So in Pakistan also we are seeing whooping cough again. There is an intensification of the vaccines also. Whooping cough actually is a characteristic whoop.
Okay.
And the catch in the breath, then the child is continuously coughing in as some bullet firing, and in sudden then there is a whoop. It sucks in the air, and this is very characteristic of diagnosis. There are no specific diagnostic tests for that, but if the medical person identifies this whoop, this is sufficient to diagnose. And that's again, whooping cough is a treatable condition. Then we give antibiotic for that. Bordetella produces the organism. And vaccination, we are trying our level best to our nation that we should give vaccine to every child. Every child has a right to be vaccinated, and he or she can be prevented with these so many diseases. And world has eradicated. We should learn from the developed nations. There is no TB in so many developed countries.
Why is there resistance against vaccination so much in our country, especially like polio? We have so many children suffering from polio, disabled due to polio, yet they continue to fight against the vaccine as if it's some kind of conspiracy against them. And could you please tell people that if they don't take these vaccines and stop spreading all this misinformation, they're going to actually be able to eradicate it?
Again, a very painful topic. Eradication of polio. You know that we were supposed to be polio free many years ago, but still there are so many political things also have contributed to not being able to eradicate that. World has been focusing us, and there are so many teams going around. World Health Organization is very much particular about eradicating polio. Generally, these are myths, illiteracy and myths, and then political reasons. Countries like ours in underdeveloped and like developing countries, we are a nuclear nation, very proud nation. We should be able to understand the dynamics of the world, and we should be able to know that our kids are going to fight with the rest of the world in coming years. So for that we have to eradicate eradicable diseases.
Exactly. Now let's talk about diarrhea and food poisoning. We have very unhygienic food habits of children, and people don't take a lot of care of what they are feeding their child, or our unhealthy water as well, polluted water, adulterated food. So how common is diarrhea? And number one, once a child develops diarrhea in our part of the world, they stop feeding or making them drink. They say, oh no, don't give him this, don't give him that. As a result, they start dehydrating and dying. So the importance of rehydration in diarrhea, the importance of ORS, the importance of clean drinking, and the complications that it can lead to.
So again, under 5 kids, we have number 1 pneumonia, and number 2 is diarrheal diseases. So so many kids are we're losing our kids because of the diarrhea, which is very simple disease to be treated. So safe water is a right of every human being on this planet, that he or she should be given a safe water supply. Our government also is trying to provide safe water. Safe water is very important, and safe water is a boiled, clean, germ-free water. And then idea of that directly getting water from the well is more cleaner, and the water from a spring is more cleaner is not right. We should get out of this. We have to boil it. We have to clean this water, and from the germs and impurities. And these are the things which are actually causing diarrhea. And the other thing is this is so many things which are being cooked by the cooks who are not actually hygienically clean.
Street vendors are actually selling it outside.
So it's very important to, especially the summer is coming.
Right.
So in summer there are so many kulfis and the ice creams are being vended out by the vendors, which are actually they're not that clean. And and then you can see a person standing outside in a hot weather and selling that
with the garbage
sweating
right
and
there,
garbage
and
around
the
that.
flies around there.
How can that be kept clean?
Exactly.
So this is our responsibility to give our kids right, clean, germ-free food.
Right. And what about the complications of diarrhea in case one doesn't rehydrate, and the importance of ORS?
Yeah. So whenever your child starts passing loose water stool, 3 things are very important to identify in the diarrhea. One is blood is coming or not.
Okay.
Is there blood in the stool? The stool are watery? Is there any flecks of stool in that, or it's just water passing? Or the stool has more than the normal volume? If it is more than normal volume, more than 3 times a day, so these 3 things are alarming things. So first thing which can be done easily and doable is giving ORS, which is very commonly available and very cheap also. So start giving ORS the moment you think that your child is having diarrhea. Right. So you can prevent the death of a child who is going to be some very important person in this world. So start ORS. So ORS, the invention of ORS has reduced mortality in diarrhea in so many countries. Our neighbor Bangladesh was number one in the world with the mortality due to diarrhea. And they were the actually pioneer to start the rice water and then ORS, and then whole world got the idea, and now they have controlled diarrhea. Right. So diarrhea is a controllable, easily preventable and treatable disease. So giving ORS, and then another part which you actually highlighted is not stopping the food. It's very common. Then the moment you start passing loose stool, they start giving khichdi.
Yeah, and they stop everything else.
You start everything and they give you khichdi, and khichdi is very difficult to eat for a child. So you have to give normal food, whichever the child used, because you need calories, you need energy to fight this organism. Right. So keep on giving the food which you have been giving, but only thing which you have to ensure is cleanliness and germ-free food and water.
What is the role of zinc? They say you should be giving zinc to children once they have diarrhea. Is that true?
This is another invention, finding that zinc actually, this mineral actually stabilizes the intestinal villi. The villi is the part of the intestine which actually absorb things, and they stabilize on the basement membrane. And at that place, these villi are stabilized because of zinc. Okay. So whenever there is diarrhea, zinc is washed off because of the villi being swept away because of the diarrhea. So giving zinc has reduced morbidity and mortality of in the newborn. There are huge studies in the world. So zinc is now part and parcel of the treatment of diarrhea. Whenever you start ORS, you start giving zinc to these kids.
Now there's another very common finding in children is fever. Sometimes they have unexplained fever, sometimes it's bacterial, viral, but the fever goes uncontrolled. People do not bring it down at the right time. They do not give the pain, the acetaminophen or anything that is needed, and they don't take them to the doctor till it actually becomes so fatal that it starts giving them fits. So how important is it to bring down fever? What is the normal range of fever? What are the different causes of fever, and how do we go about it?
Firstly, fever, the phobia of fear of the fever should not be in our mind. Fever is just a symptom; it's not a disease. It's a symptom and it shows us that some pathogen, some organism which is not helpful to the body, it's injurious to the body, is in the body. So it's just a symptom, and sometimes because it causes uncomfortable feeling in the body, so we control this. And there are a few percentage of the kids under 6 years who can have fits with the fever. This is another condition which is called febrile fits, and between 6 months to 6 years, these are the kids which are prone to be having seizures with the fever. So it's identifiable, it runs in the family. So if in his family there's some kid who always gets fits with the fever already, so we have be very aggressive in treating this fever. Rest fever, you should identify the cause, which is what is causing this fever. So if there can be sore throat, there can be gastroenteritis, there can be a boil on the skin, there can be ear infections. There are so many parts which can be urinary tract infection, especially baby girls. It's very common in urinary tract infection. So these things you have to, and in the coming months we will be again facing malaria, which is another painful reality that we are not able to eradicate malaria also. So malaria is also coming in the coming months. So we have to identify the cause. Whenever the cause will be identified and treated, fever will be treated. Rest, paracetamol is the drug which actually brings it down temporarily. But it doesn't treat it. So temporarily it will bring it down for a few hours. But again, because of the cause which is causing this diarrhea, this fever, it will recur.
But then they do another one big mistake is because the child is shivering, they keep covering the child in multiple layers of blankets and clothes instead of actually cooling down the child. If you tell them you need to give them a shower, bring it down by cold sponging, they don't like the idea very much. So could you stress on how important it is for them to bring it down, the fever?
Actually, we should understand how fever happens. There is a thermostat in our brain which actually is set higher because of this organism, these reasons of the fever. When it is higher, set higher, so inner part of the body, it starts, muscles starts shivering, starts to produce heat to increase the inner core temperature, to raise the core temperature. So this shivering and of the twitching of the muscles, it actually is producing the heat, which is actually increasing the core temperature. So like any other hot object, you bring it down because of the convection, conduction, radiation. These are the processes which we studied in early part of the studies. So we have to ventilate this child, we have to give fresh air, we have to open the child with the less layers on the body, we have to put water on that and just wash it. And this fear of the washing in the giving a shower during fever is so much exaggerated. So I don't know why it happened, but maybe in ancient years when there was not enough facility to cover the children, to keep yourself warm, so maybe at that time it happened. And subsequently, what was the reason? Maybe pneumonia was the reason of that fever, so they thought it is because of the washing. So don't be afraid of washing that child. Just wash this child as any other hot object is cooled. The child should be cooled.
What about meningitis? That is another very fatal condition in our part of the world, and people also ignore that, and they don't recognize the symptoms of stiffness or whatsoever. So what are the symptoms of meningitis? How important is very, very timely diagnosis and quick action so that the life can be saved?
Unfortunately, meningitis, even by the practitioners, are neglected. And very in our training time, when we used to diagnose with the lumbar puncture and getting CSF and examining that, it has reduced now. So diagnosing meningitis is not that difficult. Child is 3 cardinal symptoms. Child is vomiting, child is having headache, and photophobia is covering his head, and he is having fever. And if it exaggerates, time passes, then it can cause fits. So if the child is covering his head, he's complaining of headache, and he's vomiting with the fever, always consider meningitis. Again, meningitis has very bad consequences. If we half treat meningitis, it is going to cause brain damage. The child may live, but he will not be having a productive life. So early detecting and treating completely meningitis is so very important. If we will not, if maybe we delay the diagnosis and we treat half-heartedly, we don't complete that treatment, the child is going to be handicapped. He is going to have brain damage. So early detection, for the parents and common our audience, 3 things: vomiting, headache, and photophobia and fever. If it is this combination, whenever it comes, always think of meningitis. And it's very simple to diagnose. We just have to put a needle. And there is another phobia, that lumbar puncture, that if you will puncture the back spine, so it's very simple, just drawing blood from the vein, it's just drawing fluid from the spine, and then we identify and diagnose that. And with that diagnosis, we give antibiotics for a certain period of time, and it is completely treatable. So delaying the diagnosis and delaying the medical attention is very, very vital to save these kids. And again, there are so many vaccines available for now. Pneumococcal vaccine is available, meningitis vaccine is available. These to prevent meningitis in the early part of the world. And as we know, first 2 years of life, brain is being manufactured structurally. So first 2 years are very vital for the brain.
What about measles? Recently there was an outbreak of measles in the United States as well, and it is affecting a lot of children across them as well, not only us. So how common are measles? How do you diagnose measles, and how do you treat them?
Measles, another treatable condition which comes in the 6 diseases which we are vaccinating against. And there were so many outbreaks in the world. So WHO has now decided to increase the frequency of the vaccine.
Okay, the MMR,
So,
the measles,
we are
mumps, rubella.
giving it 9 months.
Right.
We are giving it 15 months. We are again giving it 2 to 5 years again. So this vaccine has been more aggressively being given. And measles, again, a very cumbersome disease involving all the mucosa, eyes and mouth, GIT, all respiratory part of the body, and then all inner part is just having this rash over the skin also, and high grade fever, and there are so many sequelae after that. You know, if you get our child, if gets measles, there is a state which is called post measles state. For next 6 to 8 weeks, child has relative immunodeficiency. And in those 8 weeks, he can get any infection because he is immunodeaf. So it's very important to prevent this disease. Whenever you have any kid in the class, in the house, in the place where you are going, if there is any child with a rash, avoid the contact. It's very important. It's a communicable disease, contagious disease, and highly contagious. If you just come across for a few hours to a person, to a child who is having this measles, you can get it. So avoid this exposure and get your child properly vaccinated. And again, the treatment again is doable, and complete recovery is there. And getting this, I want to highlight this. There is a long-term side effect of measles. So in the later part of the word, you can have brain damage. These antigen antibodies, then they can damage the neurons. So early detecting, preventing a vaccine. You know, after polio, the WHO is targeting measles to eradicate from the world. It's very easily eradicatable. The next target to eradicate is measles from the world.
The symptoms are fever, cough, coryza, and that Koplik spots. What else?
It starts with actually three cardinal points that are very important with the measles. It's involvement of the conjunctiva, cough, and rash.
And the rash, how does it look? How does it appear, so that we know this rash is very different from mosquito bites or very different from chicken pox and all of that?
So this is red. There is one thing which is called measly rash. Measly rash. It's a small reddish rash starting from the back of the ear and the face. And there are so many other differential diagnoses in the measles. So whenever there is rash, it doesn't mean that it is always measles. So having cough is very cardinal. Rash with cough is cardinal, and then involvement of the mucosa, like inner mouth and eyes, they are watery and reddish, and there is exposure also, and it happens around after 6 months. Under 6 months, one should not diagnose it.
What about chicken pox? A lot of children suffer from chicken pox, and then they start, scratching it and ruining it more. So how do we deal with chicken pox?
Chicken pox, again, very important disease causing school absences, and usually children get it from the other colleagues whenever they start going to playgroups and in the kindergarten. At that age, they catch it from their colleagues. So there are blebs, and there is very itchy blebs. So we have to soothe it up. The calamine, we give it and soothe it should not itch, and it gets treated. It completes its course, and 1 week a child gets over it. But if scratching happens on the face, then it gives a permanent scar. Otherwise, it's not scarring disease. But if you scratch it and you damage your skin, then it can cause a scar. So one should avoid scratching and giving that calamine so that the child should not feel itchy.
And keep the child away for at least 2 weeks.
Yeah, and if you feel that your child is having this chicken pox, don't send the child to the school at least. Prevent other kids from that.
We have a huge problem with hygiene also, and they don't pay enough attention to the hygiene of the child, don't change their clothes as often, let them eat or drink and let it stay on their face, and then they're touching everything, and they're not washing the utensils or the clothes or the environment, and as a result of that, a lot of children have repeated bacterial infections in terms of impetigo on their face and other things as well. So could you stress on why, how important it is to change and, especially toilet train, or, to have good hygiene habits and toilet habits for children, because this is a big source of bacterial infection again and again, which is very, and if a child gets wounded, they don't take them for, immediate cleansing of the wound, or there's no proper wound care. As a result, the infection also starts spreading to the rest of the body.
To our surprise, from newborn till adulthood, showering and cleaning is so less in our part.
I don't know why. Even though we say that it is half our faith, but we don't seem to be displaying it.
Our religion and our society. I don't know why it happens, because of the myths again. Even our newborn, they are not showered for months.
For 40 days, they don't shower, the mother and the child. Can you believe how horrible that is?
And I have seen a child, for 4 months the child was not given shower. The mother was cleaning the child with a wet tissue. So skin rashes, skin diseases, and in the early part of the life, then pneumonias and diarrheas is very common in these kids. So always keep the older time, when there was not even proper facility to warm the water, and there were open toilets and open washroom. At that time, maybe there was some incidence of hypothermia. But nowadays, when there is easily you can get warm water, you have washrooms inside your bedrooms. So how can you not wash your child? So give a bath the child to the child daily. The child should be given
and
bath
clothes
daily.
Should be changed, nappies should be changed.
And again, another thing, they don't wash after the child is wet. They just wipe it, and these fancy words of wipes, tissue wipes,
fragrant
on the media,
wipes.
They're actually contributing this. So if we avoid that, the child has to be washed all the time. Whenever the child gets wet, you have to wash it.
Even after eating, they don't tend to wash their face or their hands as a result. All of this. There's another also very big practice common practice amongst us, is that when they have a viral infection, for example, they have a flu or they have a viral infection, they start giving them antibiotics on their own, making them antibiotic resistant. By the time the child has grown up, he's been exposed to every antibiotic by self-medication of the parents, asking on WhatsApp groups, asking on Facebook. I don't understand how hard is it to ask a doctor instead of asking each other, and everybody is so so conveniently they suggest, oh, just give them augmentin, give them this, give them that, and 2 or 3 are giving 4 or 5 things together: antifungal, antibacterial, steroid, all in one. So the importance of not self-medicating, especially in children, because children are so delicate, their dosage, their indication is only known to a pediatrician, not even a general physician.
This is another side effect of the social media. Then people just Google it, and they think that it's causing any benefit to them. These are the side effects of the social media. Then in our part of the world, we give over-the-counter medication. There is no particular law to stop selling these medicines. It should only be given on the prescriptions. So almost every child, when it comes to me, the child is treated by the mother because of her old experience, and
self-medication.
And as a habit, we like to give our advices free.
Yes. Everybody is a doctor in our country. Everybody.
So I think doctors have also contributed in this, because there is a mistrust also between doctors and the patient. So this trust level has to be there.
It's unfortunate because a lot of general physicians do not refer to pediatricians. That is another very huge issue when they start dealing with children problems on their own, and sometimes complicating and spoiling them, because that is, I think, very, very that needs to be addressed as well.
And a qualified doctor Actually, if one is qualified in say neurosurgery, he's put so many effort in to become a neurosurgeon. So he should not he should be very proud of it that I am a neurosurgeon. So he should treat the neurosurgery only. So I don't know why even very qualified doctors don't keep on interfering the other specialties. In any and general doctor who should know that at what time he has to send this child to a specialist clinic. So at that time, that is called family medicine.
Yeah.
You have to treat
The common ailments, and once they're
because you should know the limit. That at this time I have to seek advice of the specialist clinic. So this is very important.
Right. Now let us talk about children's nutrition. What exactly is a good nutritious diet for a child to prevent this childhood obesity, diabetes that is very rampant now, a new problem, and to also prevent malnutrition and all those deficiencies, calcium, vitamin D that used to lead to all these bone deformities, brain regression in the past?
First 100 days are very important to give a good nutrition to the child. The most common problem which we face is that they keep on giving the child milk till whatever they like. Sometimes I have seen 8 to 9 years old children being fed with a bottle, only milk. So milk is only for first 6 months. Exactly. One should understand. At 6 months you have to start weaning. And weaning means that at that time you have to wean it off from the milk. And you have to give everything to this child now, so that by 1 year of age he should not take a feed in the daytime and only as a habit at night time. So and dependency on the milk should start be weaned off at the 6 months of age. So WHO has categorically set as age of weaning at 6 months. So exclusive breastfeeding at 6 months, and from 6 months onwards you have to wean it off, and by 1 year the child should not be having breastfeed during daytime. Right. It has to be as a habit at night. So for a proper nutrition, at 6 months you have to give exclusive mother feeding. It's very important. So try to encourage your young mothers that they should breastfeed. It's very complete nutrition. And it's made for the human also. Antibodies, colostrum, giving anything, everything to combat these pathogens. So at 6 months you introduce a semi-solid food which is milk and rice based, and then you keep on adding new food and all that. And we are, as we know, for a balanced diet, as you asked me about balanced diet, there are groups of nutrition which has to be given in certain combinations to the child. The proteins like meat, beef, and there is a myth also that beef is a lesser protein than. It's not like that. You can give beef, you can give chicken, you can give mutton, you can give fish, you can egg, you can even combination of the pulses. So this is a protein which you have to give. It's very important for the child to, because the muscles are being built, bones are being built, child is linear and transfer growth is going on. So you have to give, child needs proteins. And then there are dairy products, butter, cream, cheese, yogurt. One of these things should also be given. Then carbs like rice, wheat, and potatoes. This also should be added in these. And fourthly, the fruits, seasonal fruit. Any seasonal fruit which is is cheaper, easily affordable, can be given. You don't need any very costly fruits.
Exactly. So we have to keep the child away from junk food, especially processed meats and these sugary drinks and energy drinks, fizzy drinks and all of that.
Actually, it has to be balanced.
Right.
Then fizzy drinks, actually they decrease the appetite of the kids.
Right.
So they don't take other things. But stopping altogether sugar and stopping all the salt is not advised. It should not be excessive, but it should not be given
moderation
in a moderation, in a balanced way. I have seen in social media and on the Google, they say that no sugar for the 2 years. It's not like that. you can give, but it should not be only sugar.
Yeah.
Say if you give, excess of everything is not good.
The only thing bad is like artificial dyes
Yeah.
and emulsifiers.
Artificial
and all of that.
diets, and we should avoid that. These canned food and processed foods. Actually, the industrialization and working women, actually they brought it into that, and then media
Convenience, actually.
glorifying these things as
Packaged food.
as very something very energetic. It's not like that.
Thank you so much, Dr. Sohail. Thank you so much for joining us. As we leave and as we conclude, just one message about the use of social media and how it is affecting children. And then we'll bid farewell to our great viewers today. But thank you so much. You gave us such an in-depth analysis on children's health. Just one message for our audience regarding limiting the use of social media for children.
It's very currently it's very alarming that we are seeing so many attention deficit, autistic children. They don't pay attention to the parents, and they are getting one-sided input from the social media. Since birth, at the time of birth, parents give mobiles to these kids, and it's very convenient. I've seen in my OPD, my mother comes with the two kids, she gives mobile to one kid, and he is in the chair and watching that mobile and sitting for say 15, 20, 30 minutes, and he is not bothered about anything else. So in Twin City, we are seeing so many these autistic children, and although research is going on, and one of the things I think, and physicians and pediatricians are thinking that use of social media, screen use can be the one of the cause of this. So you limit that, spend time with your kids. This is the time that you have to further train him. You have to give your experience to your kids. Spend time with your kids. They are very precious, and they are your future.
Thank you so much, Dr. Sohail, for joining us. It was a pleasure having you. And as you heard from the pediatrician himself, that you need to not just profess love for your child, but actually take action to show and prove that you love him. And that is only possible if you feed them a very good, balanced, nutritious diet and spend enough time with them. Thank you so much for watching. Inshallah, we'll meet you next week. Allah Hafiz.